the pain in the epigastrium, that means what people commonly call as heartburn.
Correct.
So it is below the heart and below, above the bimbi or umbilicus. In this area, person gets pain. Alright, and this pain goes up and he gets burning sensation in the lower part of the food pipe. If you suffer from hyperacidity, some degree of leakage is always happening, but it doesn't cause any symptoms. But if there's lot of acid in the stomach, then that acid, extra acid, means the concentration of the acid is more, it can still go up and cause problem.
You are watching Surgery Simplified. शस्त्रकला सरल शब्दों में.
हेलो नमस्ते, वेलकम बैक टू सर्जरी सिंप्लीफाइड, शस्त्रकला सरल शब्दों में. मेरे साथ है डॉक्टर निखिल.
नमस्ते.
तो हमने पिछले कुछ एपिसोड्स में बहुत सारे कंडीशंस के बारे में डिस्कस किया था, विच वर एक्यूट स्टमक पेन.
करेक्ट.
तो आज हम क्या टॉपिक डिस्कस करने वाले हैं?
हाँ, तो जैसे एक्यूट एब्डोमिनल पेन होता है, वैसे क्रॉनिक एब्डोमिनल पेन होता है. क्रॉनिक का मतलब क्या है कि एक्यूट एब्डोमिनल पेन इमरजेंसी है, अचानक पेन होना, 1 या 2 दिन का जो पेन रहता है, ऑल ऑफ अ सडन, आउट ऑफ द ब्लू. क्रॉनिक एब्डोमिनल पेन मीन्स बार बार ओवर अ पीरियड ऑफ वीक्स और मंथ्स, बार बार पेन होना, एब्डोमेन, रिकरेंट एब्डोमिनल पेन और क्रॉनिक एब्डोमिनल. दैट मेनी ऑफ द कंडीशंस इन दिस डोंट नीड सर्जरी ऑल द टाइम. That is first point. So they can be treated with medicines, but diagnosing what is the cause of the chronic abdominal pain will determine whether we can cure it or not.
Okay.
Most conditions, maybe I can divide it as 70-30. 70% will need surgery, but almost 30% will not need surgery. But the important thing is, very common conditions amongst these 30% which don't need surgery but they need other treatments where they can be controlled.
Okay.
So let us first list out what are the conditions that cause chronic abdominal pain.
And these are the ones that don't need surgery.
No, we'll list out all of them.
Sure.
And then in each condition I'll say where it is required and where it is not. So let's start from the top here. The pain in the epigastrium, that means what people commonly call as heartburn. So it is below the heart and below, above the bimbi or umbilicus. In this area, person gets pain. Alright, and this pain goes up and he gets burning sensation in the lower part of the food pipe. This is called epigastric dyspepsia. Okay, epigastric means above the stomach. Dyspepsia is a common terminology for that burning pain which many people get after eating a heavy meal, after having alcohol. Everybody has suffered dyspepsia at some time. It is commonly called heartburn.
Okay.
Now, in this we have got 3 conditions which we will discuss. One is called gastroesophageal reflux disease, or commonly known as GERD. In this, the reflux of the stomach contents goes up into the lower part of the food pipe. And because the content has acid in it, it causes inflammation and swelling in the lower part of the food pipe, which the patient feels as heartburn. Second condition is gastric ulcer. That means it is an ulcer in the stomach. And the third is duodenal ulcer, which is an ulcer in the first part of the duodenum, where the stomach ends and the small intestine starts. That part you get a duodenal ulcer.
Duodenal is a separate organ?
Duodenum is the beginning of the small intestine.
Achha.
The small intestine has 3 parts. The first part is called duodenum, second is jejunum, and the third is ileum. The duodenum starts from the stomach and it goes around the pancreas in a C shape, goes behind, goes to the posterior wall of the abdomen where it is fixed. From there you get the jejunum starting, which is called the duodeno-jejunal junction or the DJ junction. From there the jejunum starts and it goes and then goes seamlessly into ileum and then the ileum comes into the right part of the intestine where it ends in the large intestine. We call it ileocecal junction where the appendix is.
Okay.
And then from there the right colon starts, goes up, then you have the transverse colon, left colon, goes into the rectum and intestine. So this is the whole intestine. So ulcer in the first part of the duodenum and the stomach. So let's start with what is GERD. So in GERD, which is called as Gastroesophageal reflux disease, what basically happens is that between the food pipe and the stomach, there is a valve. So this valve is partially anatomical and partially physiological. What I mean is that the distance, now the esophagus or the food pipe is predominantly in the chest, okay, but it goes through an opening in the diaphragm and goes into the abdomen little bit. So you have what is called as the abdomen portion of the food pipe and the thoracic portion of the food pipe. The abdomen portion of the food pipe is generally around 3 to 4 centimeters in length. Okay. And then from that arises stomach like this. If you draw like this and like this, you have seen how it. So this gap is very important. This angle has to be acute angle. And the diaphragm, from the diaphragm, there is a valve which goes around the esophagus like this. And it contracts whenever you are eating so that food cannot go up and it goes down. Okay. Plus the length of this esophagus below the diaphragm determines the pressure inside the esophagus. So you know that as per physics, Laplace's law says that the pressure inside a cylinder is inversely proportional to the diameter. That means if the diameter is smaller, the pressure will be more. So it is very critical that the diameter of the esophagus remains a certain size and the length of the esophagus below the stomach remains a certain size to maintain a pressure more than the pressure in the stomach. This is the physiological sphincter. The length and diameter of the esophagus causing a high pressure area so that the food and acid cannot go up. Second is the angle which it makes, acute angle with the stomach, which obviously increases the length of the esophagus. If the angle becomes obtuse, it means the length is becoming smaller. Got it? And the third is the sphincter around the diaphragm. Okay? Now, if the sphincter becomes lax or the esophagus angle changes or the pressure in the stomach increases, then the reflux will happen. What happens in this? Why does it happen? A, if you put on a lot of weight, the weight of the abdomen will press on the stomach and increase the weight in the pressure in the stomach, and it will overcome the high pressure area in the esophagus. If for some reason the sphincter becomes lax, it loses its tone, then also it will cause reflux. Okay? And if you suffer from hyperacidity, some degree of leakage is always happening, but it doesn't cause any symptom. But if there's a lot of acid in the stomach, then that acid, extra acid, means concentration of the acid is more, it can still go up and cause problem. Okay? How do you diagnose gastroesophageal reflux disease? First is do a endoscopy. On endoscopy you can see the opening, whether it opens and closes properly or not. Second, because of the acid going into the lower end of the food pipe, it will become red and inflamed. Alright. If this is over a longer period of time, these reddish areas, if there are superficial ulcers in that, wound, ulcer means wound, it is also called as Barrett esophagus, B-A-R-R-E-T. Now what is the importance of Barrett esophagus? Barrett's esophagus, if it is seen, it is a precursor to developing either stricture, that means narrowing of the esophagus, or cancer. So if you find Barrett's esophagus in the lower end of the food pipe, then you must do a biopsy and keep the person on regular endoscopy follow-up. Regular endoscopy to see whether the Barrett's esophagus is gone or not. Okay. So in summary, heartburn, which is caused by GERD, is because of hyperacidity and laxity in the esophageal sphincter. What causes duodenal ulcer and gastric ulcer? Again the same. Hyperacidity with, now see, the stomach has a lining which normally can resist acid because acid is produced in the stomach, right? But in some conditions, the lining of the stomach gets breached, small ulcers happen, right? And in some people, the acid is so high, the amount of acid produced is so high that it can literally start making small burn holes into the stomach and then go into the inner layer of the stomach are not protective against acid. So once it makes an opening and acid goes inside, it will erode inside the wall of the stomach and make an ulcer, right? And same thing. Now normally the acidity is only in the stomach and there is a valve between the stomach and the duodenum. Like there is a valve between the food pipe and the stomach. This is known as the pylorus. Pylorus is a sphincter. Again, there is a thickened muscle which will control. So what happens when the food is eaten by a person? For 2 hours to 3 hours, it remains in the stomach and it is churned like a mill, girni bolte na, and it is made into a paste. And over a period of 2 hours, little food is passed into the duodenum. Okay, the duodenum has alkaline. That means it has got alkaline. The juice that is produced in the duodenum is alkaline. So it is able to neutralize the acid because it comes in small quantities. But if more acid is there in the stomach, or the acidity is more than what the capability of the duodenum to neutralize, then acid will come into the stomach, the duodenum. Now the duodenum lining is not favorable for protecting against acid. So the acid will erode into the stomach, into the duodenum and make a duodenal ulcer. So this is the physiology of GERD, gastric ulcer and duodenal ulcer. Now what are the causes? Because these are lifestyle diseases.
Okay.
The first thing is smoking. Okay, smoking is very bad for both GERD, gastric ulcer, duodenal ulcer. What does smoking do? It stimulates more acid. The tobacco, that is the nicotine, reduces the resistance of the inner wall of the stomach from allowing the acid to go inside. It reduces that. And third, it reduces the alkaline secretion in the duodenum. So it causes all the things. It reduces the alkaline content in the duodenum. It increases the acidity, and it also weakens the wall of the stomach and intestine. So smoking is the single most important factor which if you stop smoking you will not get this. Second, hurry, curry and worry.
Hurry, curry and worry.
Hurry, curry and worry. Hurry means type A personality.
Okay, what is
that? Means type A personality means all the time wanting to do everything perfectly and in a hurry, always, I have to reach the office, I have to eat the food in 2 minutes, I have to do this. Type B personality is more relaxed. Type A personality is more aggressive personality, and they are affected by non-punctuality, not getting things done properly. If there is a little bit of dust there, they will get affected. Kyun ne saaf kiya, they lose their temper. That sort of person. The other person is more relaxed. So the type A, the hurry. Curry means all kinds of things like alcohol, smoking, eating very spicy food, right? This is curry. Curry covers everything. But the most important in that is smoking. Second is alcohol. And then is highly spicy food. Because all these can stimulate acid production. And the third is worry, anxiety. Now what does anxiety do? It releases hormones in your body, and these hormones then increase the acid output. So there is something called as basal acid output and maximum acid output. Basal is the amount of acid that is secreted at rest. And maximal acid output is whenever it is stimulus. So whenever you eat food, or you smoke a cigarette, or you have a drink, or you take spicy food, any stimulus, maximum acid will produce. Now the amount of acid produced in response to a stimulus is maximal acid output, and it is found consistently that all people suffering from GERD, duodenal ulcer and gastric ulcer have more maximum acid output. So the response to any stimulus which would normally cause acid to increase is more in these people. Now the acid, because it becomes more, is not able to the normal way of controlling the acid, whatever the acid will do, they are overpowered. So the lining of the stomach gets burnt, like I told you, and so on. The alkalinity in the duodenum does not neutralize all the acid. Okay. Now these are the basic causes. And wearing very tight dress also. Very tight dress you should not wear. You should not do excessive bending, because again whatever causes pressure. So excessive bending, you should not wear tight dress, you should not be overweight, and you should not have these alcohol, smoking and spicy food. Okay. So this is the lifestyle part of it. So you should avoid all this. But the good treatment, good thing in this is all these conditions, they come with epigastric pain or pain. Now in a gastric ulcer from duodenal ulcer, how do you differentiate? In gastric ulcer, pain is brought on by eating, because the stomach is, the ulcer is in the stomach, and only 10% of ulcers are gastric ulcers, whereas 90% are duodenal ulcers. Whereas the patient gets 2 hours afterwards, because we told you 2 hours is the emptying time of the stomach. So when the stomach food is passing from the stomach into the duodenum. So persons who get pain on empty stomach are the ones with duodenal ulcer. Patients who get pain on full stomach are gastric ulcer. Patients who get heartburn are GERD. All the 3 conditions can be together or individually, each of them. Now the treatment is same for all of them. First is lifestyle modification, which is stop smoking, stop drinking, eat less spicy food. If you are overweight, lose weight. If you are in a job which requires excessive bending, avoid it. One more thing you can do for GERD is, at night when you sleep, the acid can roll up into the food pipe. So you can raise the head end of the bed. Head end of the bed by 9 inches to 12 inches. So 15 degrees. So if it is like this, if you sleep like this, the chances of acid going up are less. So this is the part which is lifestyle. But there are very good medicines available. When I was doing my surgery training, the commonest surgery we did was for duodenal ulcer, which was vagotomy, gastrojejunostomy. That means you cut the vagus nerve which is responsible for secreting the acid, and then you join the jejunum to the stomach, bypassing the duodenum. So the food will go directly bypassing the duodenum. That was the operation. After drugs like ranitidine came into picture, that is H2 receptor antagonist. So histamine is something which is available in the stomach. Stimulation of histamine creates acid. So the first drugs that came in the market were histamine receptor blockers like ranitidine, famotidine, these drugs.
So these drugs basically do the
reduction of the acid. Alright. But now they are superseded by, you must have heard of pantoprazole, Pantod, omeprazole, esomeprazole. These are better drugs, because what they do is they block the final pathway of when the acid is released. Any stimulus, even with food.
Got it.
So where ranitidine could reduce the acidity by 50 to 70%, here it reduces by 80 to 90%.
Achha.
Okay?
Okay.
And the pH comes above 4. If the pH comes above 4, normal pH in the stomach is 1 to 2. So if the pH comes above 4, then it will cure GERD, gastric ulcer and duodenal ulcer in 90% of the patients.
Okay.
Very few today need any kind of surgical procedure. I have not done a single gastrojejunostomy, vagotomy since 1995. The last one I did was in 1995.
Achha.
Okay? So that it tells you. Whereas before that it was the commonest surgery which was done. So the treatment for all this is to give a long course of these medicines and other than lifestyle. Now there is one more thing which is very common in all these people, which is called as H. pylori infection. It is a bacteria which has been discovered in most of the people who suffer from duodenal gastric ulcer and GERD. H. pylori. It is a organism which comes through infected food and water, and it is very common. Almost 80% of people in India have H. pylori. But when the H. pylori growth becomes more, then it can lead to problems of acidity. So what does H. pylori do? It secretes certain substances, again, which affect, that is, increase the hormones. That is one hormone called gastrin, which releases acid. So H. pylori infection increases gastrin, so it increases the acidity.
Okay.
And it also reduces the mucin production. The inner lining produces mucin, like your saliva has contains mucin. So mucin production is protective against the acid. So H. pylori infection reduces mucin, so it increases the chance of ulcer. So H. pylori infection is treated, or it is proven when you do endoscopy, you do a urease test. It secretes urea. Okay, so if you do a urease test, you can say that H. pylori infection is there. Now H. pylori infection needs a 14-day or 2-week course of 3 drugs. One is omeprazole and 2 antibiotics, amoxicillin, amoxicillin and metronidazole. So 3 triple therapy. Sometimes you can give 4 antibiotics. 4 drugs: clarithromycin, amoxicillin, metronidazole and omeprazole. So most of the times in 2 weeks, patient will get completely okay. And you can prove it. There's a breath test available for that urease. You don't have to do endoscopy every time to prove that the H. pylori is treated. Plus he will get symptomatic relief.
Right.
Now there is recurrence. Now if it happens again, you give for 6 weeks to 8 weeks. If it still happens, you give for 1 year. They are safe, most of these drugs. There are no side effects. So you can give it for months together and completely cure it. So very rarely do you need surgery. So what is the surgical treatment? Now there is an endoscopic treatment and a surgical treatment. For GERD, through an endoscope, you can put a stitch and narrow that opening, or you can inject something which will narrow it, like under the skin, which will become scar tissue will form, and that I told you, the lumen becomes narrow, then the pressure will increase.
Correct.
So if the lumen is lax, you inject certain substances there which will narrow the opening, or you can even put a stitch through an endoscope. So there's an endoscopic treatment available, or you can do a surgical treatment, but surgery is not so good because it has side effects. A laparoscopic surgery is done where the stomach is wrapped around the esophagus and it is sutured so that it will lengthen the esophagus. Stomach is like this, na? So you separate the stomach and wrap it around the esophagus and take stitches. This is known as an anti-reflux procedure. Okay. For duodenal ulcer and gastric ulcer per se, there is no surgical procedure required. Very few people really don't heal. The only thing you have to remember is that in some people, gastric ulcers could actually be gastric cancer. So if the ulcer is not healing, it is necessary to take a biopsy to see whether this gastric ulcer is because of cancer, means a cancer appearing as a gastric ulcer, and not the acidity related ulcer. Correct? So once you take a biopsy and if it is gastric ulcer, you can treat it conservatively without surgery. Okay. The only reason to operate in these people is complications. So the complications are, we discussed one last time, that is perforation.
Correct.
Okay. So if the ulcer becomes big and it perforates through the intestine, it will perforate. Okay. Second is if it goes behind, there is a blood vessel behind on the posterior wall of the duodenum. Duodenum is like this. If it makes a hole up, it will perforate outside. If it makes a hole at the back, there is a blood vessel. They will have torrential bleeding. They will bleed blood vomiting. Okay. Torrential. It doesn't stop because it's an artery. So you have to go and either stitch the vessel or remove that part of the stomach. And the third is when the ulcer heals, sometimes it narrows and it narrows the stomach opening. It is known as pyloric stenosis. And that needs surgery. Again, you have to do a bypass. You have to take the intestine lower part and join it to the stomach so the food can go on a separate. So pyloric stenosis or stenosis, lower end of the stomach, bleeding from the ulcer, or a hole in the duodenum because of the ulcer, needs surgical treatment. Per se, duodenum ulcer doesn't need any treatment. It heals with medicines. Okay. So bottom line, now one very important point I want to tell over here. Very, very important point. The predominant symptom is pain here and burn.
The burn.
Right. Now, the lower part of the heart attack of the inferior wall of the heart can also present as acidity. And you must have heard, you had acidity karke hospital gaya and mar gaya. So it is very important, especially for resident doctors working all over in wherever they are working, that if a person comes in the middle of the night or early morning or even at any time with these symptoms, it is always good practice to admit him,
And keep
hoping
under observation.
that it is duodenal ulcer and not myocardial infarction, not heart attack. Because if it is ulcer, he is not going to die.
Right.
Okay, you can always treat him and discharge him the next day. But if that person is having acidity-like symptoms, but because of a heart attack, he will die if you don't treat him. Likely to die. So any person coming, especially at odd hours, because see, most people know that they can take omeprazole, pantoprazole, Gelusil, they take all that. You have to assume that when the patient is coming to you at an odd hour, he has already taken this and it has not reduced it.
Correct.
Alright? Whereas it's supposed to reduce the acidity by 90%, but why is it still getting pain? Which means it probably is not acidity.
Correct.
Admit the patient, do his ECG, do his Trop D करके एक test आते हैं, which is a blood test which you can do like a on a drop of blood. So Trop D and if necessary echo and ECG, keep him in the ICU under observation. If he is okay, discharge him the next day. But you will save a patient. Maybe out of 100, 2 people may turn out to be heart attack. But those 2 people, if they are missed, can die. So this is a take-home message that if anybody, even for patients, just don't think that it is acidity. Don't keep drinking soda and limbu soda and all that nonsense. Gelusil. If the acidity persists and you are feeling weak,
Right.
and if you are sweating along with this, please think that this is a heart attack, not a acidity. Okay? So the commonest differential diagnosis, what you can confuse between acidity is inferior wall of the heart, because the heart sits on the diaphragm. So if there is any infarction or heart attack in that portion of the heart, it will present as
Acidity.
present like acidity. Okay? So that's the take-home message, that if you get these symptoms which are not treated with normal medicines, please go to a ICU and get yourself admitted and let the proper investigations be done with the view that this is heart attack.
Okay. All
Okay.
right.
So this is about GERD, gastric ulcer and duodenal ulcer. So in the next episodes, we will be discussing other causes of chronic abdomen.
Sure. Thank you so much, Doctor.
Thank you.
Yet another informative episode for you, all of viewers out there. So if you have any queries, any questions, or if you're facing any such symptoms or anything, or if you know anybody in your circle who is going through such stuff, so please let us know in the comment section, and we'll be happy to help you with Dr. Nikhil's suggestion over there. Please subscribe to our channel, like our video, and stay tuned for more interesting episodes. Thank you.